Orange claims, what Vietnam veterans need to know. Welcome to an essential guide for Vietnam veterans and their families on Agent Orange claims. This comprehensive resource will walk you through the process of obtaining VA compensation for conditions related to Agent Orange exposure. We understand the challenges you've faced and the lasting impact of your service. Our goal is to provide you with clear, actionable information to help you navigate the claims process and receive the benefits you deserve. Whether you're a veteran who served in Vietnam or a family member seeking to understand the options available, this guide will offer valuable insights and step-by-step instructions to ensure you're fully informed about your rights and the support available to you. Understanding Agent Orange, a brief overview. Agent Orange, a powerful herbicide, was first used by the U.S. military in Vietnam in 1962 as part of Operation Ranch Hand. Its primary purpose was to defoliate dense jungle areas, denying enemy forces cover and exposing supply lines. After nearly a decade of use, the U.S. military discontinued the spraying of Agent Orange in Vietnam in 1971. By this time, millions of gallons had been dispersed across vast areas of the country. In 1991, Congress passed the Agent Orange Act, directing the Department of Veterans Affairs to presume certain diseases are related to herbicide exposure during military service. This act paved the way for easier access to benefits for affected veterans. The dangers of Agent Orange exposure. Agent Orange contains TCDD, a highly toxic form of dioxin. This compound can persist in the body for years, potentially causing long-term health effects. Exposure to dioxin can lead to DNA damage and cellular mutations, increasing the risk of various cancers and other health conditions. Agent Orange exposure can interfere with hormone production and regulation, potentially leading to metabolic disorders and reproductive issues. Studies suggest that the effects of Agent Orange exposure may extend to children of exposed veterans, highlighting the long-lasting impact of this toxic herbicide. Presumptive conditions. What they mean for veterans. Presumptive conditions are health issues that the VA automatically assumes are connected to a veteran's military service. For Agent Orange exposure, this means that if you have one of these conditions and served in a qualifying area during the Vietnam War, the VA presumes it's related to your service without requiring additional proof of causation. This presumption simplifies the claims process significantly. Veterans don't need to prove a direct link between their condition and Agent Orange exposure, which can be challenging decades after service. It reduces the burden of evidence on the veteran and can lead to faster approval of disability claims. The list of presumptive conditions is not static. As new scientific evidence emerges, the VA periodically reviews and updates the list. This means that veterans should stay informed about any additions to ensure they're not missing out on potential benefits. Amyloidosis, a rare but recognized condition. Amyloidosis is a rare disease where abnormal proteins called amyloids build up in various organs, potentially causing serious complications. It's one of the lesser-known conditions on the VA's presumptive list for Agent Orange exposure. Symptoms can vary widely depending on which organs are affected, but may include fatigue, weight loss, numbness in hands or feet, and swelling. Diagnosis often requires a tissue biopsy to confirm the presence of amyloid proteins. While there's no cure, treatments aim to slow the production of amyloid proteins and manage symptoms. Options may include chemotherapy, stem cell transplants, and organ-specific treatments to support affected body systems. Veterans diagnosed with amyloidosis who were exposed to Agent Orange are eligible for VA disability compensation. The VA also provides health care and may cover treatment costs related to this condition. Chloracne, the telltale sign of chemical exposure. Chloracne is a severe skin condition characterized by acne-like eruptions, particularly on the face, neck, and behind the ears. Unlike typical acne, it's directly caused by exposure to certain chemicals, including dioxins found in Agent Orange. Chloracne typically appears shortly after exposure, but can sometimes develop years later. In many cases, it can persist for years or even decades after the initial chemical contact, serving as a long-lasting indicator of toxic exposure. Treating chloracne can be challenging as it often resists standard acne treatments. Management may involve both topical and systemic medications, as well as specialized skincare routines tailored to the individual's symptoms. The VA recognizes chloracne as a presumptive condition for Agent Orange exposure if it appears within 1 year of exposure to a degree of 10% or more disabling. Veterans with this condition should document its severity and onset carefully when filing a claim. Chronic B-cell leukemias, understanding the blood cancer link. Agent Orange exposure can damage DNA in blood-forming cells, potentially leading to the development of chronic B-cell leukemias years or even decades later. Over time, damaged B cells may begin to multiply uncontrollably, crowding out healthy blood cells and leading to symptoms such as fatigue, frequent infections, and easy bruising or bleeding. Diagnosis typically involves blood tests and bone marrow biopsy. Various types of chronic B-cell leukemias, including hairy cell leukemia, are recognized by the VA as presumptive conditions. Treatment options vary depending on the specific type of leukemia, but may include chemotherapy, targeted therapy, or immunotherapy. The VA provides comprehensive care and support for veterans diagnosed with these conditions. Type 2 diabetes mellitus, a common but serious condition. Research has shown a significant link between Agent Orange exposure and an increased risk of developing type 2 diabetes. The exact mechanism is not fully understood, but it's believed that dioxin exposure may interfere with insulin production or sensitivity. Common symptoms include increased thirst, frequent urination, unexplained weight loss, and fatigue. Diagnosis is typically made through blood glucose tests. Veterans experiencing these symptoms should seek medical evaluation promptly. The VA provides comprehensive diabetes care, including medication, blood glucose monitoring supplies, and access to nutrition counseling. Veterans with diabetes may also be eligible for additional compensation for related complications such as neuropathy or cardiovascular issues. Hodgkin's disease, lymphatic system under attack. Hodgkin's disease, also known as Hodgkin's lymphoma, is a cancer of the lymphatic system. It's characterized by the presence of Reed-Sternberg cells, which are abnormal lymphocytes that multiply uncontrollably. Common symptoms include painless swelling of lymph nodes, persistent fatigue, fever and night sweats, and unexplained weight loss. Any veteran experiencing these symptoms should seek immediate medical attention. Diagnosis typically involves a lymph node biopsy, followed by imaging tests to determine the stage of the disease. Early detection can significantly improve treatment outcomes. As a presumptive condition, Hodgkin's disease qualifies affected veterans for disability compensation. The VA also covers treatment costs, which may include chemotherapy, radiation therapy, or immunotherapy, depending on the disease stage and individual factors. Ischemic heart disease, the silent threat to veterans' hearts. Ischemic heart disease occurs when the arteries that supply blood to the heart become narrowed or blocked, reducing blood flow. This can lead to chest pain or heart attacks. The link between Agent Orange exposure and increased risk of heart disease has been well established through numerous studies. Symptoms can include chest pain or discomfort, shortness of breath, irregular heartbeat, and fatigue. Some veterans may experience silent ischemia, where there are no obvious symptoms, making regular checkups crucial. Diagnosis may involve stress tests, electrocardiograms, or coronary angiograms. Treatment options range from lifestyle changes and medications to procedures like angioplasty or bypass surgery, all of which can be covered by VA benefits. The VA offers comprehensive cardiac care, including preventive services, advanced treatments, and cardiac rehabilitation programs. Veterans with ischemic heart disease may also qualify for disability compensation, with ratings based on the severity of the condition. Multiple myeloma, when plasma cells go rogue. Multiple myeloma begins when plasma cells in the bone marrow start to grow out of control. These abnormal cells can form tumors in multiple bones throughout the body, hence the name multiple myeloma. Common symptoms include bone pain, fatigue, frequent infections, and kidney problems. As the disease progresses, it can lead to bone fractures, anemia, and increased calcium levels in the blood. Diagnosis often involves blood tests, urine tests, bone marrow biopsy, and imaging studies. Staging helps determine the extent of the disease and guides treatment decisions. Treatment may include targeted therapy, immunotherapy, chemotherapy, and stem cell transplants. The VA provides access to state-of-the-art treatments and clinical trials for eligible veterans. Non-Hodgkin's lymphoma, a diverse group of blood cancers. Non-Hodgkin's lymphoma is not a single disease, but a group of blood cancers that develop in the lymphatic system. Unlike Hodgkin's disease, NHL can start in various types of lymphocytes and can occur almost anywhere in the body where lymph tissue is found. Common symptoms include swollen lymph nodes, fever, night sweats, and unexplained weight loss. Diagnosis typically involves a lymph node biopsy, blood tests, and imaging studies. The specific type of NHL is determined through detailed analysis of the cancer cells. Treatment varies depending on the type and stage of NHL, but may include chemotherapy, radiation therapy, immunotherapy, or targeted therapy. Some patients may require stem cell transplants. The VA offers comprehensive treatment options and support for veterans diagnosed with NHL. Parkinson's disease, the neurological impact of Agent Orange. Parkinson's disease is a progressive neurological disorder that affects movement. It occurs when certain nerve cells in the brain gradually break down or die, leading to a decrease in dopamine levels. Studies have shown a higher incidence of Parkinson's among Vietnam veterans exposed to Agent Orange. Early signs can be subtle and may include tremors, stiffness, slowed movement, and changes in speech or writing. As the disease progresses, cognitive changes and other non-motor symptoms may also appear. There's no single test for Parkinson's disease. Diagnosis is based on medical history, symptoms, and a neurological exam. Brain scans and other tests may be used to rule out other conditions. The VA provides comprehensive care for veterans with Parkinson's, including medication management, physical therapy, and access to specialists. Assistive devices and home modifications may also be covered to help maintain independence. Peripheral neuropathy, when Agent Orange affects the nerves. The VA recognizes early onset peripheral neuropathy as a presumptive condition if it appears within 1 year of exposure to Agent Orange and resolves within 2 years of the date it began. Symptoms typically start in the extremities and may include numbness, tingling, burning sensations, and weakness. In some cases, the condition can progress to affect balance and coordination. Diagnosis may involve nerve conduction studies, electromyography, and sometimes skin biopsies to examine nerve fiber density. Blood tests may be conducted to rule out other causes. Treatment focuses on managing symptoms and may include medications for pain, physical therapy, and lifestyle modifications. The VA provides various treatment options and support services for affected veterans. Porphyria cutanea tarda, the skin manifestation of toxin exposure. Porphyria cutanea tarda is a disorder characterized by painful, blistering skin lesions that develop on sun-exposed areas of the body. It's caused by a deficiency in an enzyme that plays a crucial role in the production of heme, an important component of hemoglobin. Exposure to Agent Orange has been linked to an increased risk of developing PCT. The VA recognizes PCT as a presumptive condition if it becomes manifest to a degree of 10% or more within a year of exposure to herbicides. Symptoms include fragile skin, blisters, and hyperpigmentation on sun-exposed areas. Diagnosis typically involves urine and blood tests to measure porphyrin levels, as well as genetic testing in some cases. Treatment may include phlebotomy, medications such as hydroxychloroquine, and strict sun protection. The VA provides coverage for these treatments and ongoing management of the condition. Prostate cancer, a major concern for Vietnam veterans. Studies have shown that Vietnam veterans exposed to Agent Orange have a significantly higher risk of developing prostate cancer. This increased risk persists even decades after exposure, making regular screenings crucial for early detection. Early prostate cancer often has no symptoms. As it progresses, symptoms may include difficulty urinating, blood in urine or semen, and pain in the pelvic area. The VA recommends regular PSA tests and digital rectal exams for at-risk veterans. Treatment depends on the stage of cancer and may include active surveillance, surgery, radiation therapy, or hormone therapy. The VA offers state-of-the-art treatments and participates in clinical trials to provide the best care for veterans with prostate cancer. Respiratory cancers, the lingering threat to veterans' lungs. The VA recognizes cancers of the lung, bronchus, larynx, and trachea as presumptive conditions related to Agent Orange exposure. These cancers can develop decades after initial exposure, highlighting the long-term health risks faced by Vietnam veterans. While Agent Orange exposure increases risk, other factors like smoking can compound it. Symptoms may include persistent cough, coughing up blood, chest pain, hoarseness, and difficulty breathing. Veterans experiencing these symptoms should seek immediate medical attention. Diagnosis typically involves imaging tests, biopsies, and sometimes bronchoscopies. Accurate staging is crucial for determining the most effective treatment approach. The VA provides comprehensive cancer care, including surgery, radiation therapy, chemotherapy, and immunotherapy. Veterans with respiratory cancers may also be eligible for additional compensation and support services to manage their condition. Soft tissue sarcomas, the hidden dangers in connective tissues. Soft tissue sarcomas are a group of rare cancers that develop in the body's connective tissues, including muscles, tendons, fat, lymph vessels, blood vessels, and nerves. The VA recognizes most types of soft tissue sarcomas as presumptive conditions related to Agent Orange exposure. These cancers often don't cause symptoms in early stages. As they grow, they may cause a painless lump or swelling. Pain can occur if the tumor presses on nerves or muscles. Regular checkups and reporting any unusual lumps to your doctor is crucial for early detection. Diagnosis typically involves imaging tests like MRI or CT scans, followed by a biopsy to confirm the type of sarcoma. Proper diagnosis is critical, as treatment can vary significantly depending on the specific type and location of the sarcoma. Treatment often involves a combination of surgery, radiation therapy, and chemotherapy. The VA offers access to specialized sarcoma treatment centers and clinical trials, ensuring veterans receive the most advanced care available. Filing a claim, step-by-step guide for veterans. Start by collecting your military service records, medical records, and any documentation of your Agent Orange exposure. If you don't have these records, the VA can assist in retrieving them. Include any civilian medical records related to your condition. Obtain a current diagnosis and medical assessment of your condition. The VA may schedule a compensation and pension exam to evaluate your disability, but having recent medical records can expedite the process. File your claim online through the va.gov website, by mail, or in person at a Virginia regional office. You can also work with a veterans service organization to help you file your claim. Be sure to specify that you're filing for an Agent Orange-related condition. After submitting your claim, you can track its progress online. The VA will review your claim and may request additional information. Once a decision is made, you'll receive a letter explaining the outcome and next steps. Importance of medical records in your claim. Detailed medical records are crucial in establishing a connection between your current condition and your military service. For presumptive conditions, having a clear diagnosis and documentation of service in a qualifying area is often sufficient. Your medical records help the VA assess the severity of your condition, which directly impacts your disability rating and compensation level. Include records that show how your condition affects your daily life and ability to work. Ongoing medical records can demonstrate the progression of your condition over time. This is particularly important for conditions that may worsen or lead to secondary health issues, while not always necessary for presumptive conditions. Additional medical opinions or studies linking your condition to Agent Orange exposure can strengthen your claim, especially for conditions not currently on the presumptive list. Understanding VA disability ratings. The VA uses a rating scale from 0% to 100% in 10% increments to determine the severity of your service-connected disability. This rating directly affects the amount of monthly compensation you receive. Even a 0% rating can be beneficial as it acknowledges service connection and may provide access to VA healthcare for that condition. If you have multiple service-connected disabilities, the VA uses a combined ratings table rather than simply adding percentages. This can be complex, and it's often helpful to work with a VSO to understand how your ratings combine. Higher ratings not only increase monthly compensation, but can also affect eligibility for other VA benefits such as vocational rehabilitation, education benefits for dependents, and priority group assignment for VA healthcare. Understanding your rating is crucial for maximizing your benefits. Secondary conditions, expanding your claim. Secondary conditions are health issues that develop as a result of a service-connected disability. For Agent Orange claims, this could include conditions that arise due to your presumptive condition. For example, diabetes might lead to secondary conditions like neuropathy or cardiovascular issues. Work closely with your healthcare provider to identify and document any health issues that may be related to your primary service-connected condition. Keep detailed records of symptoms, treatments, and how these secondary issues impact your daily life. You can file a claim for secondary conditions at any time. You'll need medical evidence showing the connection between your service-connected condition and the secondary condition. A medical opinion from your doctor can be particularly helpful in establishing this link. Successfully claiming secondary conditions can lead to an increase in your overall disability rating and compensation. Each secondary condition is evaluated separately and can contribute to your combined disability rating. Appealing a VA decision. Carefully read the decision letter to understand why your claim was denied or why you received a lower rating than expected. Identify any errors or missing information that could strengthen your case. Under the Appeals Modernization Act, you have 3 options: higher level review, supplemental claim, or appeal to the Board of Veterans' Appeals. Each option has different requirements and timelines. If you're filing a supplemental claim, gather any new and relevant evidence that supports your case. This could include additional medical records, lay statements, or expert opinions. File your appeal within the specified time frame, typically 1 year from the date of the decision letter. Consider working with a VSO or attorney to help navigate the appeals process and strengthen your case.